Hello everyone, welcome to Move Well, Live Well. We've been having a number of people coming in with issues regarding their shoulder. And what we're finding with some of these folks is they're getting a lot of tightness, cramping, trigger points is occurring here in the subscapularis muscle. It's one of the rotator cuff muscles of your shoulder. And it's right in here. To access it, it is right here, kind of in the armpit area. It lies in the front part of your shoulder blade. So your shoulder blade is right in through here. So it's in the front part of it. To access it is right in through here. And you can feel on yourself that this gets tender on a lot of folks. And what we're finding, some of these symptoms these people they're having issues with raising their arms. Sometimes they can't quite get, it feels like my arm's weak. I can't reach the top. They can get pain a little bit in the front, sometimes down in through here, kind of in the medial, the inside part of the upper arm. Even in the wrist, they can get pain in the front of the wrist with referred pain because of the trigger points that's occurring through here. But a lot of issues is kind of in the back, right in through here. You can feel all this because they kind of all insert, the rotator cuff muscles all have a common insertion right in through here, the side of the shoulder, where it keeps the shoulder in the socket. And that's what the rotator cuff muscles do, is keep that shoulder stable in the socket. And so they're having pain and discomfort in and through here, in and around the shoulder, sometimes in the wrist, sometimes the inside part of their upper arm. And they're having problems sometimes even just reaching. They can't quite reach overhead. They get kind of stuck like this, or even reaching across to the other shoulder like this. It feels like it hurts and it's pinching in through there. So a great way to alleviate some of that crampiness, that trigger points, the spasm in that subscapularis muscle is to mobilize it a little bit. It's a hard area to kind of get to. So this is what I've kind of set up here. Let me take this off the thing so you can kind of see what I've conjured up here. So I put this is a an Olympic barbell here. So this is an Olympic barbell, and what I've done is I put the lacrosse ball. You can see here I put the lacrosse ball right on that sucker, and in order to affix it to the barbell, what I've done is I've taken some voodoo wrap. You can Amazon this, you can Google it. It's voodoo wrap. It's basically a pull-up assist band that's been cut in half, cut at one end, and it's just a long strip of rubber. You can use a TheraBand if you have TheraBand lying around. You can even use elastic wrap, that you use, for instance, to wrap up your wrists or your ankles if you've had an injury before. Athletic elastic wrap will work as well too. But the idea is to put the lacrosse ball right on this sucker, just like this. And you can see it's a nice thing to use trying to get into that subscapularis. So let me show you how to do this here. Let me put you back on here on the camera, on the tripod here, just like that. That's pretty good. Let me get over here. So, problems in here, it's going to create all kinds of problems in your shoulder. So I set this up here, and now I can lay my subscapularis right on top of, right there, woo, right on top of that lacrosse ball setup. And I can use this arm right here. I can use this arm to kind of rotate the ball around a little bit and get it in good position. See, right in here. And when I find a good spot, I'm going to hang out there. Don't just, I can kind of oscillate back and forth, push into it, relax, push into it. I can kind of contract, relax into it. I can even do a little motion. So if I'm lacking a little bit of overhead motion, I can bring my arm up like this and get some motion in through there. And that's the idea. The idea is to, the motion that you're lacking, if you're lacking lifting your arm, you want to mobilize it in that position. Let me move you guys a little closer here so you can see. Do this here just like this. Let's see a little better things what I'm doing here. It's like that. Okay, so again, I'm in here, and you can kind of see that I'm putting that right in, and I'm draping my shoulder over that subscapularis until I find, and kind of hunt around and find those tender spots, and then you're going to mobilize in through here. See that? You can even oscillate back and forth. As you can see, I'm kind of rocking back and forth on that subscapularis in there. I'm going to kind of go sideways so you can kind of see that in my, and then I can even bend my knees into it here, just like this. And I can kind of go back and forth. And again, I can take it to some range of motion right there. Ooh, that's a good one. And you can feel when you do this, sometimes you can feel the referred pain in the back of the shoulder here at where it inserts. Right in there. Just like that, nice and easy. Again, you want to do this stuff to your tolerance. You don't want to sit here in agony causing pain. It's going to be painful, but we don't want too much pain. And as you get better, as this gets more loose and gets more mobilized and more flexible in through here, the pain is obviously going to decrease. And you're going to get less and less of those symptoms in the shoulder, down in the wrist, and in the medial part of your arm where you're having those problems. And then you kind of retest it and kind of see how that feels as you open up and through there, and it's going to feel a lot looser. If you have any questions, please leave them down in the comment section below. Please like, subscribe, and share this video. And when you hit subscribe, please hit that notifications bell button so that way you don't miss any subsequent videos coming up here in the near future. Anyway, we thank you for watching. We appreciate it. We'll see you next time. Take care. Bye-bye.